It's Leslie DACH, and I am the chair and founder of Protect Our Care. And it's an honor and a pleasure to be joined today by three Texans, by Congressman Colin Allred, by Congresswoman Lizzie Fletcher, and by a resident of San Antonio, Chris GARCIA. We're here to talk today about the Affordable Care Act, about healthcare, about the threats to healthcare, about the coronavirus and our country's response to the coronavirus, both the strong steps that have been taken by the House of Representatives on both the ACA and on healthcare, and unfortunately, to also take a look at the failed response by our federal government and the ongoing efforts basically in the U.S. Senate to block meaningful COVID relief. Specifically, we join each other at a time where COVID is still raging in the White House, raging in the Senate, raging across the country. And yet at a time when the US Senate still refuses to deal with a COVID package that the House of Representatives, including our two speakers, voted on over 115 days ago. And since that time, just in Texas, 15,000 additional Texans have died, and 700,000 Texans have contracted coronavirus. Each of these deaths leaves a void in people's families and their lives, and grief that never goes away. Chris, whose dad died from COVID, will talk to us about that. My sister's partner died of COVID in March, and we know how that feels in our family every day. And these are not statistics. They are real people, real families, and real grief. We also meet today at a time when the U.S. Senate, particularly the Judiciary Committee, is considering a new justice for the Supreme Court. What's important to know about that in relationship to healthcare is that a week after the election, on November 10th, a case that was brought by the Texas Attorney General that was then brought to the Fifth Circuit in New Orleans, and as Congressman Allred and I were just talking, the same Court of Appeals with handpicked Trump judges that also allowed Texas to continue with its one drop-off box per county rule just a few days ago. That case will come before the case called Texas v. California, which is really an effort by Texas and a number of other state attorney generals to completely overturn the Affordable Care Act, will be in front of the Supreme Court on November 10th, exactly 1 week after the election. And if that lawsuit is successful, Americans will basically lose their health care. 23 million Americans will lose their health insurance at a time when 60 million Americans have filed for unemployment. 135 million Americans will lose their protections for pre-existing coverage, including all 7 million Americans who now have coronavirus on their medical records. And I'm sure our speakers will speak more directly to these numbers in Texas. Women could be charged more for their health insurance than men simply because of their gender. Seniors could be charged 5 times more than other Americans simply because of their age. And the president has made it very clear from even before he was elected, but multiple times since, that he would only appoint Supreme Court justices that passed his litmus test of voting to overthrow the ACA. So that's why these next few weeks are particularly important for healthcare around this country and in the state of Texas. So with that, let me introduce our speakers. Congressman Colin Allred is a leader of the House Freshmen. In the 2 years since he joined the House of Representatives, he has been a persistent champion for healthcare and has made this really one of his core missions as a member of Congress. And the same is true for Congresswoman Fletcher from Houston, who has been a tireless champion for the healthcare of Texans, as well as for all of America. And as I mentioned, the two of them, along with their colleagues in the House, have passed extraordinarily important healthcare legislation. They passed a bill, H.R. 3, which is a historic legislation that will dramatically reduce the cost of prescription drugs for nearly everyone in America. A bill that was sent to the Senate and has so far died in the Senate. They passed a bill to build on the ACA to make healthcare even more affordable by guaranteeing that nobody's premiums would be more than 8.5% of their income. That bill, too, has died in the Senate. They passed the HEROES bill, which provided necessary funding for state and local governments, necessary funding to keep our schools safe, necessary funding and a national plan for testing, only two to die in the Senate. And I'm sure we'll hear about this from them. And we'll be joined by Chris GARCIA, whose dad died of COVID. And as he and I shared our stories over my sister's partner, who also died of COVID, this is so personal. The grief never goes away. It comes out of nowhere and hits you when you're in your daily life. So I want to thank all of our speakers. I want to thank all of you for joining. When we're finished with our conversation, we'll open it up for questions. Let me hand this over now to Congressman Allred. Thank you.
Well, thank you, Leslie, for that introduction. And I really do want to thank Protect Our Care for hosting this virtual bus tour and for doing all that you've done in my time in Congress. I've been proud to work with you because what we're really trying to do here is save lives and expand healthcare coverage and give people a chance. And that, to me, is very personal, being the son of a single mom who has battled breast cancer and who I know how important healthcare is. And I'm really glad to be joined by my friend Lizzie Fletcher. She's a fantastic member of Congress and one of my very dear friends, and members of Congress say that, and we really mean it when we say it. And by Mr. GARCIA, who we know will bring home the reality of the crisis that we're in. And I have to say that no matter where I go in the 32nd district that I have the honor of representing, and no matter what event I'm attending, the issue of access to affordable healthcare is always the #1 issue that comes up, because it affects all of us, and because it is, as Leslie said, so deeply personal. And that's why, since my first day in Congress, I've led the charge to stand up to this administration's cynical and I think disastrous lawsuit in the federal courts to repeal the entirety of the Affordable Care Act. On my first day in Congress, I introduced a resolution for the House to defend the Affordable Care Act in court, and we are the only federal entity that is defending it right now and trying to prevent them from ripping away healthcare from millions of Americans in the midst of this pandemic, and from millions more who have a pre-existing condition, which, as Leslie mentioned, now includes having contracted COVID-19. Over 7 million Americans fall into that category. And this is one of the things that makes the stakes with the Supreme Court nomination so high, and makes the stakes of this election so high, making it, in my opinion, the most important election of our lifetimes, because our healthcare is on the ballot in this election. And we need a president that will work with the Congress to lower healthcare costs and increase access to healthcare across the board. And we need Texas, of course, to finally expand Medicaid and extend coverage to more than 1.5 million Texans. I have a bill along with my dear friend and colleague, Mark Vesey, to incentivize the 14 remaining states like Texas that have not done that. We should do it, especially in the midst of this pandemic. And as we have learned to our deep, deep regret, with over 210,000 Americans dead and over 17,000 Texans dead, we need leaders who will listen to the experts and use science to make the best public health decisions and tell us the truth during a pandemic or any other time. For this year's State of the Union, my guest was a young woman from Garland named Shane. Shane has diabetes, and she has a good job and has health care, but she still struggles to afford her insulin. And in America, that is just unacceptable. 1 in 4 people are rationing their insulin. And it just cannot be the case that in this country, we have 1 in 4 folks who are having to choose between paying their bills or getting the medication they need to stay alive, which is why we need real change to dramatically lower the cost of prescription drugs and insulin in particular. And that's why it's been a top priority for me. I've joined my friend Congresswoman Fletcher and my colleagues to introduce and vote for several bills in Congress that would do just that. They have, as Leslie mentioned, passed the House, even with Republican support in the House. But like so much of the good legislation that we've passed, they are stuck on Mitch McConnell's desk. And so our work is not done. And that's why we need each and every Texan to vote in this election. Vote for your health care, vote for your family's health care, vote for a better Texas and a better United States, one where hardworking folks like Shane don't have to worry about whether they can afford the medication they need to survive. Vote for leaders that will put your health care first, not partisan politics or special interests. And vote for the future that we can have, not the present that we're stuck in which we're conducting meetings like this over Zoom because we can't gather together in the same room without risking folks' lives. That's what's at stake in this election. And I'm happy to answer questions and talk about where we need to go from here. But I want to thank again, Protect Our Care, Mr. Garcia, and my colleague and friend, Lizzie Fletcher, for joining me. Thank you all.
Thank you. And I should note that there are two Texans not on this call, but in Washington today, Senator Cornyn and Senator Cruz, both of whom sit on the Judiciary Committee, and both of whom are vocal advocates of this lawsuit to bring down the Affordable Care Act. So maybe they'll take a few minutes during the break to tune into this television and see what the people of America truly feel. With that, let me turn it over to Congresswoman Fletcher, who has made such a difference in her time in the Congress, and we know will continue to do so. And as Congressman Allred said, it is a little bit less than a few weeks to Election Day, and early voting has started in Texas. So I hope everyone who's listening will go out and vote in this election because it's so important. Congresswoman Fletcher.
Hear, hear. Thanks so much, Leslie, for that introduction. Thank you to you and Protect Our Care for hosting today's virtual bus tour and for reminding people that early voting has started. And here in Harris County, we are breaking records. People broke the record for first day voting, early voting yesterday, and we're continuing to see turnout for exactly the reasons that Congressman Allred was just describing. And so I'm very glad to join you and my good friend, Congressman Allred. I agree with him. You don't always know when people say that, but truly, I couldn't imagine a better friend and partner in the Congress. And we've worked together to try to make life better for Texans. We both represent somewhat similar districts, even though Texans know there's a little bit of an I-45 rivalry between Houston and Dallas. But on issues like this one, there is no difference between the people in Houston, the people in Dallas, the people all the way out to El Paso, San Antonio, up in the Panhandle, down in the Valley. For Texans, there is no more critical issue on the ballot this year than protecting our healthcare. And I'm so glad to be here with him and also with Chris Garcia. And I'm just so grateful to Chris for being here and sharing his story and his experience for us. I think he brings it home to us and makes real the consequences and the very real loss that we are facing in our country right now during this pandemic. And so for me to be able to join, to amplify his message and to amplify the message of Protect Our Care about what is at stake in this election and what we can do, what a path forward really looks like. Because I think, what we see down here in Houston and what we're hearing are really false choices about what it is that we can do to protect our care. So, as Congressman Allred said, our healthcare is on the ballot this year, and we just can't hear that enough because it's never been more clear. We know that Texas Republicans and the Trump administration are intent on repealing the Affordable Care Act. As you mentioned, Leslie, the Supreme Court is hearing arguments from the state of Texas and the Trump administration to strike down the Affordable Care Act in its entirety just 1 week after the election. And I'm so sorry that our own state of Texas is leading the charge in that case. It is really shocking that during this pandemic that our state is leading the lawsuit to repeal the Affordable Care Act, which expanded healthcare to millions of people here in Texas and across the country, and especially during this COVID pandemic. The Affordable Care Act was passed to address real obstacles that people faced in getting healthcare coverage. If you could get coverage at all, it could be much more expensive if you had a pre-existing condition. Essentially, companies could discriminate against people on things like their sex, Women were routinely charged more, and certain women's healthcare wasn't often covered. And then, companies could discriminate on age, and older people could pay an age tax for their healthcare plans. And those were real challenges. And we knew back then how many people faced bankruptcy because of the cost of their healthcare that they couldn't afford, and because they couldn't get coverage. The ACA worked to get rid of that, to do away with that. But since that time, congressional Republicans have been working to undo it and to undermine it. And they've been failing to fund the subsidies that would make the plans on the state exchanges more affordable. They've been undermining the elements of the law that make it work. And ultimately, repealing the individual mandate, they've now undone what they're arguing in their Supreme Court case calls for undoing the entire law. So, as Congressman Allred mentioned, we've passed several bills to help address some of the known challenges that we face when it comes to the ACA. And I do have to say, he's been an absolute champion on this issue. I was so proud to vote to allow the House to defend the ACA. As a lawyer myself, I appreciate that the House is stepping in and defending this law where the administration refuses to do it. But the administration isn't just refusing to do it, it's actively fighting it. And that's not good for Texans. It's not good for Americans. I hear from people across my district here in Houston that healthcare continues to be their top concern, access to good, affordable healthcare. And we know that the state of Texas has the highest uninsured rate in the country. And I'm sorry to say that Harris County has the highest uninsured rate in the state of Texas. And this is in the shadow of some of the most innovative research that's being done when it comes to our healthcare. And this is in the shadow of incredible quality care. I represent physicians and researchers. Colin mentioned his guest at the State of the Union this year. Mine was one of my constituents who won the Nobel Prize for his research on cancer. We have the capacity and the desire to help people, to help make sure that they have access to quality, affordable healthcare and to cutting edge care. And what we see is that for too many people, they don't have access to it. And so we have to continue to work to protect our care, to make sure that people across our community and across our country have access to it. And as you mentioned, the coronavirus pandemic has only made that all the more clear. For the estimated 650,000 Texans who have lost their health insurance because they've lost their jobs, who are now facing the high cost of COBRA or considering going without insurance at all. In the middle of this pandemic, the absolute last thing families should worry about is whether they can afford or get the care that they need. So I'm glad to be with you and to help share this message. I'm happy to take questions, and I'm so grateful to you for bringing us together today.
Well, thank you. And I just want everybody who's watching this at home, because I guess that's where most of us are, and those who are, might have a chance to catch up on this after work, just how lucky that Texas is to have these two congressmen, Lizzie Fletcher, Colin Allred, to do this work, because they work it every day. And for those of you who don't follow what goes on in Washington that well, just please take my word for this, that you couldn't have two finer people representing you. The bills they've produced, many of which bear their name on critical parts of it, are meant to make lives better for people. And to do that in really in a bipartisan way. I mean, healthcare is a bipartisan issue. 90% of Americans, 90% of Republicans in polls believe in protecting people with pre-existing conditions. They believe that people should have affordable health insurance. And yet, for some reason that none of us quite understand, but can't be good, Republicans have chosen time and time again to ignore this bipartisan will and make this a partisan issue to the detriment of millions of Americans and millions of Texans, and have hit people like in the African American and Black and Latino and communities incredibly hard, and shown just how unfair our healthcare system is to them and to those who work hard every day for a living but can't afford the healthcare they and their families deserve. So thank you for all the work. Well, let me turn it over to Chris Garcia, who lost his dad, Carlos, to COVID earlier this year. His father, who I've not met, but I've heard Chris talk about, seems like he was an amazing person. And he has taken, while he's going through this grief himself, has spent so much now of his time trying to educate others and to explain to them what's at stake and how we could actually come together as a country to address this issue. So, Chris, thanks for joining us.
Thank you, and good morning, everybody. My dad, Carlos, passed away from COVID-19 complications in July of 2020. Our COVID story begins at the beginning of the year. He retired from serving close to 30 years as an inspector in the Housing Authority. He spent the beginning of this year enjoying retirement. You know, he had worked all his life, and he was finally getting to enjoy that time, that retirement time. My sister and I were trying to figure out how to get him to fly to Chicago to see his grandkids. He had seen them when they came to Texas, but he didn't like to fly, and we're trying to convince him to fly up there. He was a very generous man, always willing to lend a helping hand. You know, if you needed help, you just call him up and he'll be right there. He'd show up in his Chevy truck ready to, help you do whatever is needed. His family and friends enjoyed his laid back, a very relaxing and calming personality, and his ability to work the grill. He was very good at that. And, he liked his music from Tejano hits to Creedence Clearwater Revival. He was known for playing his music a little bit too loud. He checked into the hospital on July 7th. 2 days later, he was on a ventilator. When I notified my sister, I told her we advised her to come and fly down from Chicago right away. You don't know how it's going to go with COVID. We know some people who were on a ventilator for 30 days and they survived. We know some people who they check into the hospital and they pass right away. So we advised her to come down to San Antonio, and she stayed with us and help provide a support network. Because he was on the ventilator and because he was intubated, my sister and I were next of kin, so we had to make decisions for him. So we had to make decisions regarding treatment. And then later, as I'll talk about later, we started having to make decisions about advanced medical directives. One of the things that helped our family was my wife's an RN, she's a nurse, and so she helped explain what the numbers were that the doctors were giving us, what the treatments option meant, and help kind of just understand those conversations. We're very, very fortunate that with her medical background. We were calling the hospital twice a day. We'd get a day shift update and a night shift update. And there were many ups and downs during this time. Some days we get great news that they were able to reduce the ventilator. It seemed like he'd be doing better or at least stable. Other days were not as well. When one treatment they tried, they were unable to complete it because his body wasn't responding very well. Because of the pandemic, because of the lack of resources, he actually wasn't in a proper hospital bed, so he started getting bed sores, which is minor compared to the other complications. But when you think about what that also means, that means he's getting more treatments. That means medical staff needs to spend more time with him, or with any patient that develops complications, they have to spend more time with them. Our medical system was already stressed enough as it is because of the pandemic and because of the lack of resources that were available. Once he told us about some of the situation with his kidneys and his organs, we still had hope, but we knew where things were headed. Finally, on July 24th, he passed. We got the phone call. It was 1 a.m. in the morning. We had stayed up watching a movie. Because of the stress and everything, our sleep schedules were very off. And then we held each other, we cried. Then we had to gather ourselves because we had to start notifying family. The next morning, it was the same thing, notifying family and calling the funeral homes. And because of the pandemic, this was late July. Because of the pandemic, a lot of the funeral homes were booked till mid to late August. We were fortunate. We were able to find a funeral home that was available the next week. So we were able to hold the services. They did provide the online streaming component. which was nice. It was a beautiful service for him. He was cremated, so a week later we got the ashes, and they told us this, and it's true that when you pick up, if you cremate your loved one, when you pick up the ashes that day, it's pretty much emotionally going through the funeral services again. You're kind of re-going through all of that. Um, and that was our story. And it's interesting trying to mourn through this process, because on the one hand, you have a community of people, as we've heard, that have lost their loved ones to this pandemic also. But at the same time, it can be frustrating, because I think people are becoming desensitized to the numbers because they hear them every day. You start to see people getting more lax about, just going out and about, being in public spaces, not always wearing the mask, not always social distancing. But this pandemic has also highlighted inequalities um, in various aspects, whether it's economic or in the healthcare system. For example, like sick leave, paid time off. Now, my sister, myself, my wife, we're fortunate, we were able to take paid time off, take sick leave to handle the situation with my dad while he was in the hospital, and then take paid time off to make the arrangements and begin settling his affairs. I can't imagine what it's like for the hundreds of thousands of Americans out there who have a loved one in the hospital, but to take a phone call to make advanced medical directives on chest compressions and resuscitation, or to find out that a treatment didn't go well. Then they have to put their phone down and go right back to work with no time to just emotionally process that. As you can imagine, when you get these phone calls and you mentally, emotionally, you're done for the day to try to do anything productive, because you're trying to gather yourself at what you just heard, what you just dealt with. Um, the main thing we're trying to do, we want to make sure, is that people remember that these deaths, these people in the hospital, these aren't numbers. These are people we cared about. This is my dad. This is someone's brother, someone's uncle, someone's grandpa. Um, and just going forward, we have the holiday season coming up. Over 200,000 Americans are going to have an empty chair at their table for Thanksgiving, for the holidays to celebrate. It's definitely not going to be the same. Um, the other thing we want to do is make sure we hold our leaders accountable, especially in the federal branch. 200 plus thousand Americans did not have to die. All they had to do was listen to the medical experts, follow their advice, um, and do the right things at the right time. As far as this president, he failed to listen to the experts. He failed to take action. He failed to tell the public. This would have been a time to bring the country together for the common cause of prevention. But instead, the virus was politicized. He peddled false statements, and we still have no national plans for testing or regarding PPE. As you heard earlier, the House of Representatives passed another relief package, um, which included numerous things. Um, you heard also that the Senate has done nothing on it, and the president has not called for it to be passed, which is unfortunate. At one point, I think the president even held it hostage, saying it should wait till after the election, which is out of touch with the struggles that Americans are dealing with. We don't have the luxury of telling the rent, the light bill, the water bill. Businesses don't have the luxury of telling payroll to wait till after the election. I mean, it's basically a dereliction of duty that shows how unfit uh, the president is for duty. Um, and Mitch McConnell of the Senate, as you also heard, has also not taken action. That the COVID relief package included unemployment benefits, stimulus checks, payroll support for businesses, rental and mortgage assistance, aid for local governments trying to do what they can to protect their communities. And the Senate has not brought together their idea. So I hope people come away from this that it didn't have to be this way. 210 plus thousand Americans did not have to pass away. We should have our loved ones with us during this holiday season. the first time my dad went to Chicago should not have been uh, his ashes. It should have been him visiting his grandkids, having fun with them, showing them how he works the grill, passing that knowledge on. I really want people to remember this election cycle, and I just want people to remember that these are lives. These are people we cared about. These were our loved ones, fathers, mothers, brothers, sisters, friends, um, husbands and wives. That special coworker that would brighten up the day sometimes when things weren't going well at the office or got too stressful. So that's what I want people to take away from this, and to keep being safe and keep wearing your mask. I know it's frustrating. I get it. You know, the mask isn't always comfortable. I want to go back to the movies too. I want to go hang out with friends too. I miss doing all those things, but I miss my dad even more. Thank you. Thank you for this opportunity.
Chris, thank you. It's just hard to know what to say, and all our thoughts, um, are with you and your family as you continue to cope with this. I know when you say that, I think of when the ICU doctor brought the iPad in so that we could say goodbye to my sister's partner, his children and his grandchildren, her, me, and, while looking at him hooked up to the ventilator on the iPad and the doctor doing such a humane thing of doing that. And then the doctor saying, I think he hears you because his heart rate seems to change when you're saying goodbye. And these are things people can never get out of their minds for as long as they live. I want to give Congresswoman Fletcher and Congressman Allred a chance to add anything. I mean, I'm going to stop because it's hard for me to continue a second. And then, well, I know we have questions from folks who have been watching, but first, to either of our elected representatives if they want to add anything before we go to questions.
I would just love to say one thing. Well, two things. One, thank you, Chris, for sharing your story. It's incredibly powerful. It's incredibly important for people to know. And I think when it comes to talking about it in the context of this election and in the context of our representatives, I think one thing you said really stood out to me that just needs to be repeated, which is it didn't have to be this way. And I think it's really important for people to know that there are people out there who don't want it to be this way, for whom your father is not a statistic, and they're working every day to try to bring help to the American people. And that's what we all deserve from our elected leaders at every level of government, in the White House, in the Congress, in the State House in Austin. And your point that it didn't have to be this way, I think is the most important takeaway of all, and that we have the choice to have it be different on November 3rd.
Thank you.
Thank you.
Thank you.
Well, there's not much more I can add. I agree 100% with my colleague in thanking you, Chris, for sharing your story, and also for driving home the fact that these are not just numbers on a spreadsheet. These are real people with families who we've lost, who did not have to be this way. And I think the recent damage I think that the president has done, even since he contracted the virus and has, we hope, now gotten over it, and telling people to not be afraid of it, to that we have a cure for it, is extremely dangerous, extremely dangerous. And it's not about whether or not you're strong or whether or not you're tough. This is a extremely tricky and still very much unknown virus that does different things to different bodies. And we don't know yet all of the even comorbidities that have make it so much more lethal in, for example, the African American community and in the Latino community. We have been particularly hard hit, and a lot of very tough, a lot of very strong people who've contracted this virus lost that battle, and it wasn't some kind of personal failing of theirs. And I think the president has consistently indicated otherwise, and I find that personally to be a failure of leadership as well. But this is why we do what we do. The House has over 2 bills now put forward $75 billion for crushing this virus, for contact tracing, for testing, for quarantining and isolating, to put in place a national plan not doing what the administration wants to do, which is to push the responsibility to the states and create regional compacts in which states are competing against each other. It just doesn't make any sense, and it has failed. And it's failed from the very beginning. I remember calling months ago, and I know Lizzie did as well, for a national plan for the use of the Defense Production Act to create PPE, to create the materials we needed for testing. We're doing 900,000 tests a day. We should be doing 4 million a day right now. And if you're an NFL player, like I used to be, you can get a test. And you can get it quite quickly, but it's still not true for every American that they can get a test easily and quickly and get a rapid and accurate result. And that's a national failure as well. And we're trying to address that. That's what we voted for 2 weeks ago. Again, the Senate has not taken that up. So when you see discussions in the media about this COVID package, understand that it's not just dollars and cents. It's how the money is used. It's whether or not we put in place a national plan to finally actually do what the rest of the world has done, which is to have a coordinated response in their countries, to bring together their national resources and national directives to save their own people. South Korea and the United States had our first case of COVID on basically the same day, January 21st of this year. They have lost in the 400s. I forget the exact number of how many South Koreans have died from the virus. We're well north of 210,000. That is a failure of leadership, and it didn't have to be this way. It's no one's fault that COVID-19 came to the United States. It's a global pandemic. It would have reached our shores, but it has been a failure of leadership that it's been this bad. And hopefully we can save lives still. It's not too late. We know that regardless of the time frame on a vaccine, there still needs to be a lot of work done to prevent folks from getting the virus in the first place, because the distribution of that is going to take some time, and it's not going to be a magic bullet even when we do have it. So we still need to have this plan regardless of what happens with the research that we're also funding. And we've also provided funding for that research to try and speed it along.
Thank you. I mean, this is in so many ways a sobering conversation, but also, strangely enough, in its timing, a hopeful one, because in just a few weeks in Texas already, Americans can vote, and they can vote to reelect the 2 representatives that they're lucky enough to have, and you've been able to hear today, but also to make the right choice for the President of the United States so that we can put the resources together that this country needs to proceed, that we can reopen our economy safely, we can send our kids to school safely, and we can put this virus behind us. But we'll only do that not by wishful thinking, not by thinking only about ourselves, but by, as Chris said, listening to the scientists, and as the members have said, putting the resources together to do it. And when I was at the U.S. Department of Health and Human Services, I was our global Ebola coordinator for 2 years. And I can just say, having done that work day in and day out, and going to a White House that actually cared about people and knew how to exercise and do its job, that we can do this if we have the right leadership to take us forward. So I'll turn it back over to Mitch Harrell, who's been our moderator. I know we've got some questions from folks who've taken part of their day to hear this. So Mitch, do you want to bring those forward?
Sure thing. We've got a couple questions. The first one is, Senator Cornyn is in a tough re-election race. What do you think about him pushing through an anti-ACA Supreme Court nominee instead of passing the pandemic relief for suffering Texans?
I don't know if either of our elected representatives want to take that, but so I'll pause to see if they do.
Well, listen, I'll just say, regardless of whether or not it's an election year or not, I think it's a failure to prioritize, a Supreme Court justice that the American people clearly want to have the next president appoint over critical, funding and the resources that people need to get through not only the end of this year, but as Mr. Garcia said, to get through the holiday season. We're going to have a lot of families who are facing not only having lost a loved one or being afraid of this virus, but who won't be able to have, Thanksgiving or Christmas in which they can really celebrate, because they are in such dire economic straits. And the impact has not been proportional. It's been certain communities are hit much harder, and certain areas of the economy have been hit much harder. And that should be everyone's priority. I mean, I think the president kind of said the quiet part out loud when he canceled the negotiations with the House and said, we're going to focus instead on rushing through this Supreme Court justice. Of course, I think there is a real hypocrisy here, given what happened with President Obama's appointee, and Merrick Garland 11 months before an election, saying that we shouldn't allow a Supreme Court justice to be appointed then. But now, while nearly 10 million Americans have voted already, they're rushing through justice now. But in particular, given this judge's writings on the Affordable Care Act, disagreeing with Chief Justice Roberts' ruling. So she's already basically made it very clear that she would like to strike down the Affordable Care Act. The lawsuit that's in the federal courts, as I said in my opening statement, I think is a cynical one. It's based on extremely weak legal theory. Lizzie and I are both lawyers. The idea is that just because the individual mandate has been zeroed out, that the entire ACA should go down. I mean, there's almost no serious person who would agree with you, even on the legal grounds. But in terms of just what you're doing in a pandemic, in which right now in Texas, about a third of Texans under the age of 65 don't have health insurance. A third. I mean, you almost can't imagine the numbers that we're talking about here. And given that, this virus is going to be a pre-existing condition, given that so many folks out there have come to expect that their pre-existing conditions will be covered, that their children will be able to be on their health care till they're 26, have come to now expect the expansion of Medicaid that extended healthcare to over 20 million Americans, to try and go through the courts to do what they could not do democratically, instead of doing COVID relief and helping people get through this. I think it's just a statement of where Senator Cornyn's values are.
Well, and as usual, I would like to associate myself with the comments of my colleague, Congressman Allred, because he's made really excellent points. And I think it's just, my response is we need to be focused on this COVID package. We need to be focused on negotiations. The fact that it is not the Senate's priority to get the help to the American people in Texas and across the country who need it. I am on the phone every day with my constituents talking about the very real impacts that this pandemic is having on their lives and their livelihoods. Just yesterday, I was on the phone with small business owners who said over and over, we're hanging on by our fingernails. We need help. We need help. And it's something that the federal government can provide. And the fact that Senator Cornyn and Senator McConnell and the Senate are prioritizing something other than the desperate and immediate need of the people who they are there to represent is really disturbing. I think that we have to understand that they don't have the right priorities in this moment, and that is something that affects all of us. They have not taken seriously the work that the House has done. We tried to anticipate the need that would come in the summer after we passed several big bipartisan packages. But there were certain things that the Senate didn't want to do in the spring and said, let's put it in the next bill. And we worked and we put together a next bill that we voted on more than 100 days ago, because we knew that the unemployment benefits would expire at the end of July. We knew that people were going to have rental abilities, concerns being able to pay their rent, both at home and commercial rents. I talk to business owners all the time who are talking about the challenges they face as well in making their payments because of the ecosystem where we are dependent on each other, and we are operating differently for these last few months. And it's lasted longer than even Congress maybe anticipated in that first round of funding. And so that has to be our priority. That is our job. And, they say the House of Representatives is the closest to the people. And I think the House of Representatives has shown that in this pandemic. And the Senate's priorities right now are so out of step with the American people. And again, following what Chris said before, it doesn't have to be this way. We don't have to have a Senate that doesn't respond to the needs of the American people. And it is the opportunity of the American people to make that clear at the ballot box in November.
Thank you. I know we have some more questions, but we've taken a lot of our speakers' time. So I think we probably should end here. And I'll just repeat what Congresswoman Fletcher just said. It didn't have to be this way. It doesn't have to be this way. Texas could have expanded Medicaid. The Senate, Mitch McConnell, could have decided to do the people's business instead of ramming through a Supreme Court justice 2 weeks before an election when Americans are already voting and when there's a Supreme Court case on the Affordable Care Act 1 week later. They made these choices. Now Americans get to make their choices as they head into the ballot box or they vote by mail to have their voices heard and provide a new direction for America. So I want to thank Chris, for sharing your story, for being willing to share that story with so many people. I know it's hard to retell it. Wish you a good holiday, best you can have. Thank Congresswoman Fletcher and Congressman Allred for all they do every day, and I know they will continue to do for their constituents and the American people. And thanks to everyone for taking time out of their day to hear this important conversation. Thank you all.
Thank you.
Thanks, Leslie, and thanks, Chris. Good to see you.